Hi, everyone, and welcome to this webinar on motivational interviewing. So, I was really called to do something a little bit different, and this is a little bit experimental, but I'm hoping it'll be one of the most practical things I've created so that you can leave today with a roadmap that's going to help guide your practice to improve your motivational interviewing skills. For those of you who don't know me, I'm Dr. Joyce Faraj-Ardura. I am a dietitian. And as of recently, I am also a member of the Motivational Interviewing Network of Trainers, and I am the founder and CEO of the Nutrition Counseling Academy. So I tend to live, breathe, and really dream with everything that has to do with behavior change psychology. I've been pretty passionate about this. My PhD is in nutrition and mental health. So I started making the connections years ago, but it wasn't until I was struck with the harsh reality of the fact that I was really bad at nutrition counseling that I started to figure out, is it my clients or is it me? And what I came to the realization is that it was me. It was my fault. And there was a lot that I could do to improve my own skills. And when I started doing that, it was like night and day. Everything just shifted. My sessions felt a lot more smoother. It was less stressful. I was no longer anxious about going into session. I was not working more than my clients were working. So it was a whole shift in my mindset and my approach and my attitude, and also in the things that I was doing in session. And one of the key foundational quotes that I always have at the back of my mind when I'm with clients and when I'm doing these types of trainings, and this is by Dr. Maya Angelou, and I might botch this, but it's people will forget what you did, people will forget what you said, but they will never forget how you made them feel. So then at the end of the day, the bottom line is how are we making our clients feel in session, and how is that translating into an empowerment so that they can also continue with the work that we're doing in session outside of session. So then cue motivational interviewing. How many of you, I have the chat open, how many of you have had some training in motivational interviewing? You can just do a one. And I'm hoping most of you have had training because this is not meant to be a beginner or a foundational MI training. This is meant to be a little bit more advanced. So feel free to use the chat. Um, so I'm hoping everybody has, okay, there we go. I had the wrong chat open. Wonderful. So I'm hoping most of you have had some type of training. You've had an exposure. Maybe you took a class in college or a workshop, or maybe you've read the book. So then this is not going to be a review of too much. I'm just going to touch on some of the basics, but then I'm going to dive into what we can do to really take our practice to the next level. Okay, so are we ready? This is not going to be about memorizing more questions. It's about shifting the how we show up. So then how can we start to feel more confident, more proficient, and really work up that ladder of proficiency when it comes to motivational interviewing? In today's session, we're going to do a very brief, what is MI? Why is it so hard? Why do some people find it so hard, yet it is so simple? But what's the disconnect there? How you can find your unique voice and confidence in your practice. So my hope is that by the end of this session, whether you're watching live or you're watching the replay, you will have some practical guidance, a roadmap that you can take with you so you can figure out what you need to practice and how that's going to look like on your own or in session, so you can start to build these skills on your own, or if you need support, then where you can find that support. But the whole idea is that you start to figure out, okay, I'm right here. This is where I want to go. How do I get there? And the best way to do that is to do a little bit of self-reflection. I'm going to show you exactly how we can do that. So Ilana has shared in the chat a worksheet that I put together. You're not going to need it just yet, but have it with you for the moment when we start going into the MI proficiency quiz. So I'm hoping we can do this alongside one another. And if you have to jump off at any moment, that's okay. The replay will be available. Those of you who are in the Empowering Change membership have access to the replay for as long as you're in the membership. Those of you who are accessing this as a free webinar, you're going to have access to this through December 23rd. So it's going to give you a few days to be able to get through it. And the worksheet you can just keep. Okay. So then as we go through these, you're going to be able to figure out what is MI and also what is not MI. When to use MI and how can we really go from the doing to the being. Recognize why MI can feel hard and then normalize the learning curve. Identify ways to translate the micro skills into embodiment of the MI spirit and why that's important. Assess your own level of MI proficiency and then clarify what needs to happen for you to really start to create that unique MI voice that I'm sure you've been craving. So I would love to hear from you if you're able to. What are some of the things that maybe feel challenging for you as far as MI goes? You can type it into the chat. And I'm going to be paying attention to make sure that I'm also looking at that and maybe addressing those as well as I go through the presentation. So what is MI? This is the technical definition back from 2016. That was the third edition of the MI book by Miller and Rolnick. And some of the history here is that MI came from a practice-based approach. So this is different from something like the trans-theoretical model of the stages of change, where it's a theoretical. The MI as a practice came from observing practice. And this was really neat. They started to figure out or start to ask themselves, what is it about some therapists that their patients, their clients are better off? And this was in the substance use recovery environment. So how is it and why is it that some clients have better outcomes than others? Does it have anything to do with the therapist and how they talk, what they do? So they started to go ahead and pay attention to how the therapist would talk in session, the things they would say, how would they respond, and they started jotting down things that made sense. They started jotting down what could be making the therapist more effective and efficient in their work. And that is how MI, motivational interviewing, came to be. That was back in the 1980s. So the definition from 10 years ago is MI is a collaborative, goal-oriented style of communication that pays particular attention to the language of change. This is what people are expressing as desires or reasons or need for change in session. It is designed to strengthen a person's motivation and commitment to change by listening and exploring their own reasons for change within an atmosphere of acceptance and compassion. Now, that is a mouthful. This is quite long, it's technical, but you can start to see what things they were paying attention to and the things that stood out when they were looking at the practice of communicating in session to facilitate behavior change. Now, let's go ahead and fast forward to 2 years ago. This was the fourth edition of the MI book, and this has become widely popular. There's over 2,000 randomized clinical trials looking at MI as the main intervention. So there's a lot of evidence there showing that it works beyond just substance use. It also works in lifestyle changes in medicine and nutrition and so on and so forth. So now their goal is to try to make this more simple, to be able to make it more accessible so that other professionals, such as dietitians, are able to really integrate that without having to think about all the therapeutic lingo. So the new definition of MI is that MI is a particular way of talking with people about change and growth to strengthen their own motivation and commitment. That's so much easier to understand, to process, and it just makes more sense. So it's a way of talking with people. Okay, easy enough. We all talk to our clients. That's how we do what we do as dietitians. So then what is the struggle there? I want to take a moment to read through some of the comments here. Okay. Great. So then nothing really relevant right now, so I'm not going to address those just yet, but if anything stands out, I'm going to go ahead and address it. So then once you know the definition, let's take a look at what motivational interviewing is not. It is not lecturing with a nice tone. It is not persuading with compassion. No, it's about evoking the client's own motivation, not convincing them, not persuading them. It is not an interrogation of barriers, although we do tend to explore barriers, but it should never feel like an interrogation. That means that it's really one-sided, the power dynamics are off. It is not a quick trick to get people to change or do whatever you want them to do. That's lacking ethics. So MI is ethical. It is not the same as education. And this is a big thing that I notice amongst dietitians and in our profession. that many times we think of the main work and the value that we provide in session as being equivalent to nutrition education, and that could not be further from the truth. There is a time and place for us to provide nutrition education, and that can complement very nicely with MI, and there's a way to do that. But it is not the same as nutrition education. Nutrition counseling and MI is meant to be complementary to the things that we do. So when we are not doing MI, we tend to feel differently. So when we think about not doing MI, it's actually how we were trained. For the most part, we were trained as being the expert. So we think about expert mode or having a prescriptive approach to our sessions. Especially if you're working in a hospital setting, this is what you tend to do over and over and over. We tend to figure out, look at our nutrition care process. We have our ADIME, we figure out the assessment, and we're always looking out for what the nutrition problem is, what are the deficits, what this client is lacking, what is the problem to be fixed. The diagnosis itself is nutrition problem. So we're looking at this from a deficit perspective, trying to install something. Most likely it's going to be nutrition education. So then many times we tend to go into educating first, and then later asking about what they think about that. So then that would be you showing off your expert mode without really trusting the client that they are the expert of their own lives. Expert mode can also sound like giving lots of questions. Questions are great, and the client answers are just going to be as good as the questions that you ask. So there are ways to ask better questions. However, we also want to be guiding with reflections because that's what's going to help our clients feel seen, heard, and understood. So then when we tend to ask more and more questions and fewer reflections, maybe they're absolutely absent, then we're not really doing MI. And this is something I've noticed. Many dietitians tell me, well, I know MI. I did a workshop and I asked a lot of really good open-ended questions. Great. So you get the client thinking, but that connection piece is missing for the most part if you're not really guiding with reflections. Also, when we're giving advice without asking for permission first, we're going into that fixing reflex. We used to be known as the writing reflex. And this comes from our own innate desire to want to fix it, because that's what we've been taught, right? To assess, figure out the problem, and fix. So then this is what it can feel like to not do MI, and yet we feel like this is what we've been trained for. So we tend to do this again and again, especially when we're short on time, when we have a lot of clients we're seeing, when we're identifying the problem and we have the solutions, we tend to go into this advice giving. So then this often can feel like pulling the conversation uphill. How many of you have noticed that your clients maybe are not really eager or excited, or might not be feeling very motivated, or maybe they're saying yes just to please you, but then they leave session and do nothing, zip. So then this is when clients might be nodding, but the follow through is shaky. So then this means that we might be getting ahead of our clients. We might be pushing our own agenda. We might be wanting to fix, give advice, give education, and not really have our session be on a person-centered approach. And when you learn and you start to embody MI and you bring that attitude of acceptance and cooperation into your sessions, thinking of doing these things feels a little bit off because you know that there's a better way to do it. So then when to do MI? And the reason I brought this slide up is because I've heard of many dietitians say, but I want more than MI. I want to go beyond MI. That sounds very fancy. It sounds great, really, if you want to do more things. And there's nothing wrong with that. However, MI is not meant to be the only thing that you're doing. MI is actually, it's not meant to be done instead of other interventions. The research shows again and again and again that MI is meant to do with other, in combination with other. You can just do a search for books and you're going to see DBT and MI, CBT and MI, how to do MI with ACT, like different modalities of therapy doing with MI. So it's meant to be a way of doing what you're already doing. And this is how it perfectly combines with the work that we do as dietitians, especially if we're doing education. So we can do nutrition education with MI in a very nice way, complementary, in a way that also is adjusting to where the client is and what they need. So it's meant to be a way of doing what you're doing. It's that attitude you bring into session and then using some of the micro skills to be able to navigate the conversation towards change. Okay, everybody with me so far? Let me thumbs up. So then how to do MI. So MI is a particular way of having conversations about change, and this can be integrated with a wide array of different modalities, like I mentioned earlier, like the stages of change, the self-determination theory, and has been used to enhance retention and adherence with medical therapies. So how do we do MI? MI tends to have various components. One component is the skills. This is known as the micro skills of MI. If you've done any type of MI training, you're going to be familiar with these. So, MI micro skills is the how to navigate the conversations. And in the MI world, we love acronyms. So the oars make sense. So imagine you're rowing a boat and you're using those oars to navigate. So then this is how you do MI. And many people are really excited to start learning MI and jump straight into the micro skills. These are the open-ended questions. This is where you're inviting stories so you can really get to know the client better, trying to figure out the meaning behind what they're saying, the what, the how questions. Those are the open-ended questions instead of the closed-ended questions, or the tell me more. We tend to avoid the why questions unless it's the question that I love to ask, and it is, why is that important? That's a really great one to try to figure out what a client's motivation is, what is important to them, what matters to them. So these are the open-ended questions. Many people tend to just reduce MI to open-ended questions, and it's a lot more than this. But open-ended questions are strategically used to evoke motivation, which is great. Then we have affirmations. This is when we tend to highlight someone's strengths, efforts, values, saying something like you are resilient, you're strong, you had a lot going on and yet you showed up. So then these are basically like hugs with words. And that's something my mentor said years ago, and it just stuck with me because it makes someone feel warm and fuzzy inside. But guess what? It not only makes them feel good, it not only, helps their brains release oxytocin, it also helps you because giving an affirmation also helps you feel better. So it's a win-win. Then we have reflections, and this is the engine of motivational interviewing. You can have simple reflections where we tend to like paraphrase, not really add much to the meaning, or then we have complex reflections. This is where we show the understanding, and these are used to guide the conversations toward change. So this is going to go beyond just paraphrasing. It's going to go into what the client might be feeling, what they might be concerned about, what might be the emotions underneath what they're saying, what might be the meaning. And when you reflect and you see the client going like, yeah, that's right, it feels so good to know that A, you are on the same page, and to them, to feel understood by you. I mean, that's what's really going to create that connection. Many dietitians I've talked with, they're like, oh, reflections just feel silly. Like, I don't know what to do. I'm just like paraphrasing, like just mirroring what they're saying. It's okay to just mirror what they're saying at the beginning. Maybe add it once or twice, but then as you improve on your skill, you're going to be able to guide with reflections, and that feels really wonderful on the receiving end. So that's just something to keep in mind. Reflections should be said more often than questions. Then we have summaries, and this we're going to organize and reinforce all the change talk we've been hearing. Change talk is any type of desire, ability, reason, or need that the client expresses for change. So then this is how we show we've been listening. And I love using summaries either towards the end of the initial part of the conversation or towards the end of a session or when you're shifting gears. And I really wanted to add this ask, offer, ask at the end here because this is how we tend to support autonomy, ask for permission, while also share information. This is how we can input our nutrition education into a session using an MI adherent way. So the micro skills on their own is similar to a recipe, which is why I had this here, this little diagram. So it's basically, doing with your hands. It's a recipe, but it might be missing the heart. So when the heart and the hands come together, that's when you tend to have sessions that are more ethical. They just feel more aligned, and the client leaves with a great feeling of, wow, my dietitian really, really understood me. So those are the micro skills. Now, let's go into what doing can look like towards the beginning. It can look like you following a recipe. This is why I have the little chef here. It can look like maybe reading a script of open-ended questions. It can maybe look like asking for permission before giving advice. It can look like reflections are present, but maybe the timing is off or the selection of what you're reflecting might be a little bit off. The spirit might be only present when you're not rushed. So when you're getting rushed, you have maybe a lot of patience on your schedule. It's a lot harder to be in MI mode and it's easier to just do. And when we're doing MI, sometimes we tend to treat it like a technique to increase motivation. And there are some technical aspects to this, the micro skills or the ORs, but it's a lot more. So then this is where I come in and say, how do we go from doing to being? Because this is one of the biggest complaints I've heard about MI, and that is it feels robotic. It feels scripted. It doesn't feel like me. It doesn't feel natural. I wouldn't say those things. And they're probably right because when you're following a script, it's probably not your voice that they're hearing. And when you're learning a new skill, it's going to feel clunky. So then imagine this. When you go from doing to being, you're going to be using some of those skills, but your attitude, your heart is where it's going to be at. So many of us are very eager to learn MI and we start to learn it by looking at the micro skills. But the authors of MI actually have it flipped. They're recommending we actually start with the being and then the doing is going to be more, it's going to come more easily. So then what do I mean by this? I'm going to go into the spirit of MI and what that means because that is the being. So when I mentioned there are two different aspects to MI, we have the technical skills, the micro skills, and then we have the being, the spirit of MI. So the way some people have described this is imagine you have a song. MI is a song. You have the lyrics, the words, those are the micro skills. But the music, that is the spirit of MI. So then you can start with the music, trying to embody the spirit of MI, and then the doing is going to become a lot more easy. And when you say that this doesn't feel natural, it doesn't flow very well, you're very tempted to go back into fixing mode. That's because the way that we talk in regular conversations with our friends is not in a person-centered way. We're not going to be talking with our friends for the most part and just focusing on them. What your brain's going to want to do is you have a conversation with a friend and they tell you something happened. I can guarantee you your response is going to be, oh, me too. That happened to me too. You want to bring it and relate it to something about your life. You will be very tempted to do that in session as well, but we have to make sure that we're focusing on them. So then it's going to be about the client. I mean, I've had numerous sessions with clients. We've known each other for months or years. Very little do they know about me because the sessions are about them. Only if it's relevant, only if it's going to help the conversation do we really go into that. So then how do we go from doing to being? So MI isn't just magic wording. It is a way of relating to the patient. So being in an MI attitude means that you're embodying partnership and respect for the other person. It means that you're not rushing. You don't want to fix anyone. A person is not someone or something that is meant to be fixed by you. They're not broken. It means that you're guiding instead of pushing or following. You're going at your client's pace. If you get ahead, you're going to lose the client. If you fall behind, you're going to lower their motivation. So we have to learn their own pace and go at their pace. We have to trust the client's wisdom and autonomy. So this is the beauty of MI from an empowering stance, is that we go from I have what you need now and I'm going to install it in you, to you, the client. You have what you need and together we're going to find this. You're trusting that they have the resources and wisdom to be able to figure out solutions together with you that's going to work for them. And we're going to be using skills with intention, timing, brain, and heart. So it's all together. If it's only the hard part, then you might have some great conversations that are not going to be very productive. If it's only the brain part, only the micro skills, you might have very robotic conversations that might be missing the heart piece. So this is the heart piece right here. The spirit of motivational interviewing. And I'll be honest with you, the first time I heard about this when I was taking a nutrition counseling class, It probably went in one ear and out the other because it felt too abstract. I wanted the doing. And I know I'm not alone there. Many people want to do the doing. So they might take a list of questions, they start to implement those in session, and they start to feel like, okay, things are, I'm getting more productive answers. So this is good enough. However, if you understand the how much better it can be when we start to embody different aspects of MI and how much easier the doing becomes, it's going to be totally worth it. So then skills, the micro skills without this spirit can feel a little bit manipulative. And the spirit without the skills can be kind, but it can be aimless too. So we really need both of them. So we're going to start with partnership and just briefly into each one of these. This is really important. When the spirit of MI is present, your attitude, your presence, how we show up in session, the ORs, the micro skills, they don't have to be perfect to be powerful. So a clunky reflection that honors autonomy and evokes meaning moves more than a flawless question delivered with a fixing agenda. I'm just going to let that sit there for a second. We don't need to be perfect at anything. We just have to be intentional. So many times the secret ingredient to finding our own voice in MI is the lack of embodiment of the spirit of MI. So then what does this mean? We got partnership. So the partnership is basically forming a trusting relationship where you work together to co-create goals and solutions that are important to your client. It means you can have an agenda, but if your client has different needs and they have different desires, we're going to meet them where they're at. If there's anything concerning to us, we're going to, ask them for permission to share. But they're going to be in the driver's seat, and we have to make them feel like they are in the driver's seat because at the end of the day, only they can decide what they're going to do, if they're going to do something, and it's not up to us. It's going to be more effective than a directive approach. So behavior and lifestyle tends to be, chronic conditions require long-term implementations of interventions. So we need to create a partnership with our clients so that they're better able to implement behavior change. They're not acute ailments for the most part. If it is acute, someone needs an antibiotic, then the doctor might figure out, okay, this is what they need. They give it to them, they take it. That's very different from lifestyle and behavior changes. So here's a distinction that I really wanted to make. And both of you are experts. It's not the client up here or you up here and the client down here. No. It's both of us together. You have your nutrition expertise, your lived experience, your training, your education, and the client, only they know what's going to work for them. They have their own lived experience. Only they know what they're able, willing, and ready to do or capable of doing. But together, you're going to figure out what's going to work for them. And my clients love hearing that. I tell them my whole model is to figure out what's going to work for you. And together, we're going to figure that out. I cannot do it on my own. And you're here seeking my support because you probably have had a hard time doing it on your own. So together is where the magic happens. Then we have acceptance. And this is unconditional worth of the client. This is the client's autonomy. This is the empathy that we're able to accurately reflect. This is affirmations all in one. So when clients come to you, they likely know what they need to do, or in the past, they have been made to feel bad, guilty, or shamed into changing in the past, and that's awful. So they're coming in with all of these emotions. And you, as a behavior change expert, you understand the power of accepting people as they are unconditionally because only when they accept themselves will they truly be able to change. Very rarely has a long-term sustainable change been achieved out of guilt or shame, but it has to be coming from positive emotions. And also, this is something I've noticed in different groups. The dietitians have commented about their desire to fire a client. You don't fire clients. You accept them as they are, whether they want to change or not. They want to leave, that's okay, that's on them. But this is where the acceptance would come into place, and we don't necessarily fire a client, at least not when you're in the spirit of MI. Then we have compassion, and this is putting the client's welfare and well-being at the forefront of our sessions. This is the ethical aspect of MI. So with compassion, we have that intention to actively promote the client's needs and well-being. You show it by building genuine respect and rapport with the client, so building that trust. You don't take a client just to make more money. And the compassion here is what distinguishes us from a car salesman or someone who is just selling things out there. And the thing that comes to mind with all of these GLP-1 medications online is they have like affiliate links for these medications, and anyone can become an affiliate. And think of how that is lacking compassion and ethics, and how we in our profession are guided through the code of ethics. So then this is where we are helping clients only if we know that they're um, only if we know that we are able to help them within our scope and that we actually can help them. So this is the compassionate aspect of it. Or if we can't, this is where we refer out to someone else. So knowing our scope is also really important. And lastly, this is one of the new additions to MI is the empowerment. And this is the expansion of evocation into empowerment because this is where you believe that clients inherently have what it takes to change and grow into their potential. We believe that every client has it within them to be able to make changes. You acknowledge the client's choice and ability, reasons for change, and you guide them to uncover their strengths, resources, and wisdom. So this is where we go from I have what you need, I am the expert, to no, 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 pairing up together with them, and you, the client, you have what you need, and together we're going to find it. So this is the beauty of the spirit of MI. So the spirit and the micro skills, they both go together. The micro skills without the spirit could come off as manipulation into doing. So, an example, a salesperson. And the spirit without the micro skills could be kind but unfocused conversations. So, this could be the client talking about anything or everything without a set focus all session long. We don't want either. So, then together is better. So, then why does MI feel so hard sometimes? It's simple. So we learn about the micro skills. You probably have learned about this before. Maybe have read books on it. You've taken workshops. Why is it feeling hard sometimes? You're not broken. Your brain is rewiring because MI is not a natural way of speaking. We don't talk in this way with our loved ones, although we could with our kids or with our spouses or whatnot. But we don't necessarily do this in normal, regular conversations. So then when we think about am I feeling hard, it's because some of these things, because we care. So because we care, we want to fix, we want to help, we want to provide solutions, and that is our own fixing reflex coming in, and that is a non-MI adherent behavior. When we try to fix someone, provide solutions, we are going to be igniting a resistance within them. And then that can start to break that rapport or trust. Because of our training, it implies that we are the only experts, the prescriptive approach. So MI restructures that stance into no, it's both of us. We're both in this together. So then we need to collaborate. Then we have time pressure. We've all felt it, right? And when time is of the essence, or we have a really busy schedule, we have low energy on a particular day. We tend to default to educating because that's easier. Educating and asking questions is what we're trained for really well. So then we tend to default to that because that's our comfort area for the most part. Then the next one is discomfort. Discomfort with silence, discomfort with ambivalence, and we rush to want to resolve that ambivalence when in reality, we should be exploring that ambivalence. And for those of you who are not familiar with the term ambivalence, it means when someone is torn between maybe not changing and changing, or they could be torn between working on their fiber or their protein. It's just someone that's being pulled in two different directions. So then we can explore both of those. Or for the most part, it's going to be staying the same, not changing, and making a change. That's the ambivalence we tend to see. And the closer someone gets towards one side, the bigger the pull they're going to get from the other side. So then that's something that we just need to be very mindful of. And MI is excellent at resolving that ambivalence, but we cannot rush it. Then we have the learning stage. Early MI, just like any skill, MI is a skill. It is a communication skill. Sure, they describe it as a way of talking, but it's still a skill. And like any skill, like learning an instrument, playing a new sport, learning a new language, It feels slow and it feels awkward when it doesn't come naturally. And many times we don't like that discomfort. So we go back to what we know. We feel silly. We feel like we already have all these degrees. I mean, I already had a PhD in nutrition. I was a dietitian and it didn't feel good. It felt silly to me, but I kept on doing it. And then our impatience. We want clients to go at our pace and we want to learn the skills quickly. So then part of it is we can get frustrated when clients aren't doing the things. We can get frustrated when clients are not moving at our pace, basically, or not following our instructions. And that frustration can lead into our inability to embody the spirit of MI. We also feel very vulnerable when we seek support and or feedback. However, there's something that needs to be normalized. Because you already have maybe your master's, your PhD, your dietitian credential, it does not mean that your learning is done at that point. I mean, look at some of the most I don't know, even like the writers have coaches, right? Like writing coaches, or look at I think of sports. So look at Messi, the soccer players, they still have coaches. I mean, they're the best in the world and they still have coaches. So then how is this any different? It is still a skill. So then we need to normalize this as it is pretty normal in psychotherapy, in the world of therapists and social workers. Having supervision and getting feedback and improving on these skills is a normal part of someone's professional development. And also getting that feedback to see what you're doing well and where you need to improve. And sometimes we feel very vulnerable because we don't want that to impact our confidence. So when we think about learning MI, it is a progression and it will feel clunky at times and we will feel very uncomfortable. But our goal is to be able to realize where we are and then slowly start to walk towards the edge of that comfort zone. And then, come to that and stretch that comfort zone little by little. So this is an example that I think of when we tend to go from learning a new instrument. I don't know how many of you play an instrument out there. You start by learning the notes. What does this note mean on the piano on my right hand? What does this mean on my left hand? Can I start to play one hand? Can I play the other hand? Can I play them together? Can I read this whole song from the music sheet? So then you go from the knowing to then the doing alone. So you tend to practice. It starts to feel better, comes more naturally. You're able to identify different progression of chords. Maybe you don't have to read it. You can just start to listen to a song and then you can play it. Then you do with others, but you're still following sheet music. And then at the top of that skill development would be something like jazz improvisation. This where you're no longer reading a music sheet, but you are feeling the music and you know some of the skills that you might need to play, and you're gonna feel it to know when that would make sense to play. And this is the best analogy I could come up with when it comes to motivational interviewing. Yes, the replay link will be sent. So then when it comes to our work as dietitians, we're not playing jazz music, but the equivalent would be the knowledge. Okay, so you have maybe one or maybe a ton of books on MI. I probably have way too many. And that's the knowledge. So this is where we start to read about it and we start to think about how it might apply to our lives. But here, you might want to then take a workshop. Many of you, maybe your employment places offer workshops, maybe 1 or 2 day workshops. An hour-long workshop might not do very much. It might just plant the seed. But you might be able to do like a day-long or maybe 2 day-long workshops. Those are usually what many MI trainers tend to do. However, that is just the next step. So then you would need to practice and do some self-reflection of your own sessions. Maybe record them, see how you're doing, find where there were areas for improvement, and then focus on that for the next session. Try it out and then reflect. Then the next level would be having someone that can give you that observation and specific feedback. So then you're really going to be going from the knowledge to the doing alone, to the doing with others, to improvising. So then when does it start to feel easier? Only when the practitioner receives both individual feedback and personal coaching in addition to their workshop training. That's when the MI proficiency increases and translates into improved client outcomes. This is not me making it up. This is research. And most of the research has been on MI training of therapists. So, and this is a fairly consistent finding in training research that merely attending a workshop often has little to no impact on practice behavior. So then it kind of stays in the knowing. It doesn't translate very well to the doing. So then what I do at the Nutrition Counseling Academy is I provide all of these different steps so that individuals can go from the knowledge to the doing alone, to the doing with others, to the improvisation. So someone asked, how do you recommend getting feedback? I'll share at the end the program I'll be starting in January in case anyone's interested. But this is what I do with the Nutrition Counseling Academy. Like I offer the knowledge through the modules. And you have a whole workbook that goes with it. And then we come together and we practice. We practice, we get feedback, I review your sessions, and it's amazing. So then that's the most accelerated way to improve your skills. That's what I did. So then it took some time, but I had to get that supervised practice, get someone to review my sessions, give me the feedback, and continue to practice and figure out what I needed to practice on. And that's the best way to really accelerate your skills in a way that it's going to stick. Most research shows that after a workshop, the implementation might be minimal. And then after a couple of months, guess what? You revert back to the old practice. So then how can we really truly build a workforce that is proficient in MI and that is going to be with either ongoing feedback and supervision, or you can do some of this on your own. So if you have the worksheet that I created there as well. We're going to go into the different stages of proficiency of MI. I'm going to take a moment here to read through the comments. What are great books to read on MI? Okay, I'm going to share that, and maybe I can even send that out with your replay. So obviously we have the MI book, 4th edition. We have Don Clifford's and Laura Curtis's MI Nutrition and Fitness. This came out this year, the 2nd edition. We have MI in Healthcare. And we also have, and this is a newer one too, MI in Life and Health Coaching. So these are all books on MI. On the theory, there are different ones on the practice. And this is the workbook that I wrote. This is like 100 and something pages, single space with prompts and scripts, and different things you can use in session too. So, Yvette said, how could you go about it if you have in-person sessions? I work in public health and we do at-home visits. Okay, so when it comes to proficiency, there are some things that you can do. And I would go, if you hold on to the end, I'm going to share what you can do with your own sessions. Molly Kellogg, the queen of MI, 10, 20 years ago, she has a workbook series of 3 different workbooks. So I remember I listened to her audios back when I was a dietetic intern. She has some great things too. I believe she has moved on to other things now, maybe internal family systems. But she does have the workbooks that she wrote like 10 years ago, available, I believe, in her website. So, stages of MI proficiency. So this might be new to some of you, but there are stages of MI proficiency. And based on how you're doing on each one of these stages, we're going to figure out where you need to go next for your own practice. Yeah, I still recommend the materials from Molly Kellogg. They're amazing. So you can go to her website, definitely. I can share many of these resources if people are interested. You can type a 1 in the chat if you want. I'll be happy to share any of these resources if you want to go ahead and read them or get them on your own. Okay, so then I'm going to go into each one of these. The first one is openness to collaboration. Remember that spirit of partnership? Then we have accurate empathy, or a client-centered base. Then we have eliciting and strengthening change talk, identifying it, and then pulling more out of our clients. Then we have rolling with resistance, which is now known as dancing with discord. How comfortable we are when someone is maybe not agreeing with us, and that's okay. They don't have to agree with us. We don't have to agree with them, but we still have to accept them. And where might this resistance be coming from? Negotiate change plans. and then consolidate commitment, and lastly, flexibly shift between styles. So education, and MI. So now would be a moment where you can take out the document, the worksheet that I put together. And I'm going to go through each one of these. And if you're not able to, that's okay, because I still have the content on the screen. But you're going to be able to score yourself to see how you're doing in all of these different levels of MI proficiency. Again, there's a quiz that I created, and I'm probably going to keep on perfecting it. But this quiz is also based on the things that I teach in the Nutrition Counseling Academy's Coach with Confidence cohort. So then this is basically giving us a roadmap of what, where you're excelling and where there's room for improvement. So I want to take you through a set of different questions that are going to be focused on how often you find yourself doing these behaviors in session. And these are all MI adherent behaviors that support autonomy, that support client empowerment, that create that collaborative approach. So then you can rate yourself from a 1 if you rarely or never do these things, all the way up to a 5 if you're consistently doing these things. And if we're not able to get through all of these, that's okay. You have the worksheet so you can rate yourself. So I'm going to go through these. And I want you to pay keen attention to, as you're relating it to whether you're doing these things or not, this is also part of the roadmap as to what might be the things that you can work more on. So number 1 is you as a dietitian, I intentionally aim for partnership rather than expert-driven conversations. So an example of this might sound like, how often do you begin a session by asking what would be most useful to you today, instead of you telling the client what to do? So then letting the client choose what matters to them, what's of high priority to them. Number 2, I show acceptance, autonomy, accurate empathy, affirmations, even when I disagree, especially when I disagree with what the client is doing or saying. That's a tough one. Number 3, clients leave sessions feeling understood and respected. This is a big part of the spirit of MI. I mean, would you rather have your clients leave session thinking, wow, my dietitian just knows so much. They're like a wealth of knowledge. They know all the protocols, all the interventions. Or would you rather have your client leave session feeling like, wow, my dietitian really got me. Like, they got me. They know what I was thinking and where I was coming from, what I'm concerned about. If you ask me, I'd say the latter. So then clients leave sessions feeling understood and respected. How often would you think that's the case? Okay, moving on to the next one. My questions and reflections are guided by compassion. So they're guided by the client's welfare first, as opposed to you imposing your agenda. I mean, this can be a little bit tricky, especially in the initial, but when it comes to navigating their change behavior, then we really want to be able to guide them based on where they're at. Number 5, I evoke the client's own reasons for change before offering information. So you're trying to get at what matters to them and why. Number 6, when I catch my writing reflex or my fixing reflex, I name it and I reorient without shame. So when you catch yourself telling your client, you probably should do this, why don't you do that? That is your fixing reflex. So if you notice a reaction from your client, you're going to notice that that's breaking rapport. You can be like, oh, I'm sorry, I didn't mean to get ahead of myself. What do you think if we brainstorm some solutions together? Number 7, I can explore ambivalence and not rush to solutions while staying purposeful. So then being a little bit uncomfortable, but still navigating that ambivalence is key. This can be like the pros and cons of changing versus not changing, like a decisional balance. And this is something that I was just talking about this with a group of dietitians this afternoon, where we can brainstorm with our clients a decisional balance. So we can figure out, what can help them get unstuck. Then we have number 8. I can describe MI in one clear sentence that centers spirit. An even better one is, can you describe MI as if you were talking to a 5-year-old? This might be something I'll ask you at the end of today. So then that means that you understand it. Because in order for us to be able to go up in that ladder, we first need to have the knowledge, be able to understand it, and maybe even explain it to someone else. And then we really know that we're able to make it to the next and the next step. So that was for the relational skills. And maybe you can do your own adding up of those. It's going to be somewhere between 8 points and 40 points. Then you have technical skills. These are the ORs, or the ask, offer, ask. So then think of the last 2 weeks, and how often did you do the following in session? In most visits, I reflect more than I ask. So are you guiding with reflections? Most of the sessions I have reviewed, I have this amazing software that I can input an audio file, or I can input a video file, or we can record a session directly to the software, and it's going to basically transcribe everything that the coach or dietitian says and the client says, and it's going to categorize what the dietitian says into parts of MI. It's going to give you a score, an objective score, to see how well you're implementing MI, how well you're creating partnership, all these things. It's like mind-blowing. So are you reflecting more than you ask? A simple way would be just to see if you ever reflect in session. You can record your own sessions and then see how many reflections did I have for every question. The goal is to eventually have 2 reflections for every question. So you're guiding with reflections. And that's for MI. I believe in health coaching, the goal might even be 3 reflections for every 1 question. So it's even more heavily focused on reflections. Number 10, I use complex reflections. That means that you're not just paraphrasing, but you're actually reflecting what the client means, their feelings, emotions, their values in session to really make them feel seen. 11, my affirmations target strengths, effort, and values, and they're not just generic praise or cheerleading. We're actually focusing on the things that are relevant to the client from the things that they've been doing. So use statements. Number 12, I summarize strategically to gather change talk and set direction. And last one here, I share information with the ask, offer, ask. So first ask for permission or ask them what they know, then fill in those gaps, and then ask them, what do you think about that? Then we have, can I develop discrepancy between someone's values and behaviors without arguing? This we're creating that cognitive dissonance with the client with compassion. Number 15, I can soften sustain talk. Like this is one of the more higher advanced skills with reflections instead of counter arguing. So sustain talk is any reasons the client will give you to not change. How can you soften that? And my oars feel natural, not scripted most of the time. So again, you're seeing some of these are more complex tasks. Then we have identify and evoke change talk. This is where we have our antenna out and ready to be able to figure out what the client is saying, what that means. So in the last week or 2, how often did you easily recognize change talk versus sustain talk in real time? How often did you reflect change talk more than sustain talk by choice? If you're reflecting more sustain talk, you can keep the client feeling stuck, feeling heard, but feeling stuck. 19, I can evoke darn language, desire, ability, reasons, and need. So evoking more intrinsic motivation. I can selectively reflect the CAT language, commitment, activation, and taking steps. How often do you use rulers? This can be a readiness ruler, importance ruler, confidence ruler, and reflect the answers. And how often are you assessing confidence prior to ending a session? Okay, so stay with me. Then we have identify and evoke change talk. I'm going to skip this one. This is whether you're able to identify it here, but you all have it in the worksheet. Dancing with discord. How often have you noticed discord? This can be the client interrupting you, arguing, disengaging, early. Have you been able to de-escalate using reflections, apologies, or affirmations rather than pushing? Do you treat discord as a misalignment to repair, not defiance to confront? And can you pivot from topic or pace without losing the partnership? Now, discord is a little bit more of a complex situation, but nonetheless, it is when someone's trust is broken because of something that maybe was said in session, or it could be an unwarranted type of discord as well. Then we have planning and commitment. How often have you noticed, sorry, oh, I did that one twice. Sorry, we're gonna skip to flexibility and style. So how often are you able to shift between focus, evoking, and planning fluidly as the conversation evolves based on what you're noticing from the client? And then how often do you feel your authentic voice is present, or the MI that you're talking like feels like you? Can you balance efficiency and empathy in brief visits or when time is of the essence? So then those are some of the key behaviors that we look for in a good MI adherence session. And these are all things that we learn in the Coach with Confidence cohort, and we practice and you get feedback on. Now, this is something you can do on your own, the deliberate practice habits. So this is where you try to think about the last month, and then how often do you observe your own work? This can be recording your own session, looking at your own notes, and reviewing specific moments. So doing that self-reflection. How often do you seek expert feedback? That can be supervision or MI coding. I do both of those on actual sessions. You set small stretch goals, so one skill at a time for upcoming visits. So remember your comfort zone. You want to get to the end of that comfort zone and stretch it a little bit at a time. If you go outside and too far, it's going to feel very uncomfortable. You won't want to do more of it. You're going to go back to asking questions and educating. How often do you rehearse the targeted skill? Maybe it's working on reflections. Maybe it's working on complex reflections. Maybe it's working on affirmations. How often do you measure something? Maybe talk time, reflection ratio, number of change talk reflections. I do all of this with the software that I have. It can tell you the ratio of reflections to open-ended questions, your talk time. It's amazing. How often do you keep a simple practice log and adjust based on what you learn? And this is something as simple as asking yourself at the end of every session, and I have this here. Reflection. What areas do you want to improve on? You write it down. Choose a couple of client sessions from this past week. What went well? What did I do well this week? And then choose one or two areas for improvement. And just do that every once in a while so that you can start to have that awareness of what needs to change based on where you are at. So then when it comes to scoring, again, you can do this on your own. You have the numbers and you have the total sum. If you're below 60%, that means that you would be considered emerging. 61 to 79% developing those MI skills, and 80% or higher, you're consistently using your MI behaviors. And then you can just do just skim through the different areas. Which one did you notice you had the most ones or twos, or like the lower scores? That's going to be your bottleneck. So then those sections where you score the lowest, that's going to be your starting point. So then what can be some next steps? I'm going to leave you with some strategies that you can use for each of these based on where you're at. And you can do this on your own. If you need further support, I'd be happy to invite you to the cohort. We have only 10 more spots available. So for stage one, practical ways to develop your skills. Stage one, relational. So then begin with the client, not you. And this could be like co-creating the agenda. Think about what you normally say at the beginning of a session. How can you make it more collaborative? Offer a menu of choices. Have the client pick what they're most concerned about, what their highest priority is. Stage two, micro skills or reflections. Show that you get it, that you get the client, not just the facts, but you get the feelings and the emotions and the concerns. Aim for at least one reflection before asking a question. That's gonna mean that you're gonna be really intentional about having a reflection before you give yourself permission to ask a question. And then listen to what the client is responding. Are they saying, yeah, that's right. You got it. Exactly. When you hear these types of responses, you know you're like really on it. You're getting it. And they might just say, no, actually, that's not it at all. And that's okay. That's just information. So adding reflection or adding reflections that show emotions are going to go beyond just a simple reflecting. It could sound like this. You feel frustrated because you really want to get this right. So here's a little script that you can use. Then you have stage three, identify and selectively emphasizing change talk versus sustain talk. So then try to listen to when you hear a client expressing change talk or sustain talk. If you're not seeing clients, if you're having a hard time with this, you can practice on your own. Take a song lyric or take a YouTube interview and identify change talk versus sustain talk. I know there's an Amy Winehouse song that has a lot of sustained talk. That's one that's often been used in MI trainings. Then in session, you can jot down any client statements for change. You can just write a C next to it or an S for any sustained talk. So then the first goal is to just identify it and then we can start to reflect it. Here's an example. Let's say a client says, I really want to feel better, but once I'm starving, I really want to feel better. But once I'm starving, I have a hard time making healthier choices. I mean, it could be I really want to eat better. I don't know what I was thinking here. The first part, I really want to eat better, I really want to feel better, that would be the change talk. They're telling you what they want to feel. The second part is the obstacles. That's the sustain talk. Stage number 4, elicit and strengthen change talk. So the target is to increase the amount and the strength of change talk that you hear and that you're reflecting. So in session, this can sound like asking one evoking question early and then reflect only the change part. So you can use rulers as well. Whenever they tell you a particular thing they think they could do, maybe it's a readiness or it's a confidence thing, and they say, I'm at a 6 out of 10. Okay, ask them, okay, why not a 3? Why not a lower number? And that's gonna get them telling you why they believe they can do it. And then you're gonna reflect that. An example here, I really want to eat better, I feel better, but once I'm starving, I have a hard time making healthier choices. You can respond highlighting that change talk, and it would sound something like this. You wish eating healthier was easier. You can see it's a complex reflection because I'm making an assumption about what this person is wishing they could do. And the response to that would likely be change talk. Okay, so then I just have a few more here, but I want you to, okay, if you're leaving, Ilana you have the Google Doc there. There's also a link in case you wanted to check out the Coach with Confidence starting in January. There is a special discount for those who are watching the webinar here. So you can get $200 off if you wanted to join. Okay, so then moving on to stage 5, dancing with discord. So the target is to just notice any disalignment quickly and repair it without argument. So watch for the early signals. Maybe the client's interrupting you, there's a sharp tone, they're withdrawn, disengaged, then you might notice that maybe you're moving too fast and you lost them. And you can just say, we might be moving too fast. Let's go back if that's okay to, what's on your mind right now. Or offer choices. You can pause. Do you want to switch topics or you want to continue with this? Let them take the wheel again, the steering wheel again. That's going to help them feel that autonomy. Then stage number 6, negotiate the change plan. So we're moving from the why to the how at the right time and collaboratively. So when you're on your own, this could look like maybe coming up with a menu of choices that clients often work with you on. Based on the common goals. And then when the time is right, you can offer them if they want to see some choices, things that have worked for others. Would that be helpful? If they say yes, then you share it with them. Which of any of these sounds like something you want to focus on? And then they would go ahead and choose one, and then you can continue the conversation. So that's something that you can do so that they're engaged and they're an active part of the session. And then we just have 2 more. Consolidate your commitment, the client's commitment. And this might look like converting the momentum into a voiced next step. So with confidence language, this means that when you're having a conversation with a client, try to summarize all that change talk that you heard, the desires, reasons, strengths for wanting to change. And then you can end with how ready they feel to do something. When they hear you reflecting that, they're gonna be like, yeah, now that you're saying it, it just sits differently. So in session, you can do a brief change talk summary and then ask one commitment question. And that can be like, so what sounds like the next step for you? What might be a small step that could make a big impact on where you are right now or where you want to go? And if there's some hesitancy, you can use a confidence ruler, or you can even do like a hypothetical. So if you were to get started, what might that look like? And then asking them how ready they feel for that. So we can talk about hypotheticals, and that really helps them ease into the thinking without the stress of the doing. And then lastly, um, let's see, when it comes to your authentic voice, it's going to be really important to see how you can shift between the focusing or the evoking and the planning. And this is something that's going to be guided by what the client is telling you, what body language you're reading, what change talk they're expressing. So when it comes to MI, I actually have a whole list of questions that you could use. And I tell clients, like, you can use these questions, but like try to rephrase them and make them your own. So then see how that might sound for you. Um, Whenever you want to do a transition, you can say, we've explored the why now. Would it be okay if we talk about what this might look like for you? So you're asking for permission, but you're also transferring into the next step. Again, if you remember MI, we have 4 different processes. We have engaging, focusing, evoking, and planning. So that's what I'm referring to. So if the energy drops in the planning, go back to the evoking. So then we got to figure out we don't want to get ahead of our clients. So in summary, doing is the ORs as techniques. You're asking the right questions, and then you might be using the rulers, the ask, offer, ask, using some scripts towards the beginning. That's okay. Making it your own with your own language. The being is a moment-to-moment stance. It is collaborative, evocative, autonomy honoring, and open to the client's wisdom. This is the heart, the doing is the hands, and together is where the magic happens. So MI grows when we shift from I have what you need to you have what you need, and together we will find it. So that's the beauty of bringing both in. And MI competence develops in stages. So then getting stuck is just part of the path, and that's okay. It's how you get unstuck that's going to matter. You can use the 8 stages plus the MI proficiency quiz from the worksheet as a diagnostic tool for learning, for figuring out if you need supervision, identify your current stage, your bottleneck, what are the next steps for you. You likely need the knowledge, which would be like, the books or a shorter workshop. Then you have the deliberate practice that I gave you some ideas for, the self-reflection, getting some guidance and coaching and feedback to truly master a new skill. So some of you did ask, how does this work when you're looking for this type of support? You can look in the MENT website, Motivational Interviewing Network of Trainers. I am one of their trainers, so you can find me there as well, but you can go directly to my website. And I'm going to start the next cohort in January 8th. So this is a Coach with Confidence hybrid cohort. I'm just inviting a couple of more people. We already have 10 in. I'm going to take 20 total. And this is going to be 4 months where you're going to gain the knowledge. You're going to get the practice opportunities, the feedback to really accelerate your MI skills in the next 4 months. So this is going to be a great opportunity for those who want to start the year with the right foot and they want to feel more proficient and more confident. And speaking of confidence, there's also going to be an MI confidence in the worksheet towards the end. I added another extra quiz. This to assess your confidence in your ability to do the MI behavior so far. So you can go ahead and take a look at the link. If you're here and if you want to join before the 23rd, you can get $200 off. There's also payment plans available. But a program like this is comparable to like a $3,000 program. It's going to be 4 months of support in between call support. You're going to really develop those skills, get the practice, get the feedback, not just mine, but also from the AI software, as well as build that confidence when it comes to going from the not doing to the doing to the being MI. So I'm gonna stay here for some questions if you have any. I would be very happy if I could hear what, if anything, resonated with you as a main takeaway. And also type in your questions. I'm going to go ahead and look at the questions you submitted before to see if there's anything that I left out. But again, this is like the tip of the iceberg, but this should have given you enough of a roadmap so that you can at least start to practice this on your own. And you're going to be getting an email from me with the replay, as well as some of my like go-to MI books if you wanted to, um, learn on your own. Hmm. Okay, so let's see what some people are writing here. When someone shows up not as enthusiastic, may be unsure of seeing a dietitian. Okay, so I would just reflect what they're feeling in those cases. Maybe it wasn't their idea to be there, and that's okay. When I have introverted patients that give me one word answers, so this tends to happen more so with teenagers sometimes. We don't have to talk about nutrition. We can just talk about what lights them up, see if we can create a connection there. I really struggle to help clients with emotional eating, disorder eating, getting from pre-contemplation to contemplation. So going from pre-contemplation, they're currently not acknowledging that there's an issue. Maybe they're in denial. Maybe they're feeling like they don't have what it takes to go into doing. So we have to see what might be going on and then tackle it appropriately. We go into then the Coach with Confidence, but also the Unstuck program goes into those same things, and that one's going to be on sale later this week as well. That just gives me a good idea for another webinar, maybe just the stages of change. Remembering to stay in the MI mindset when the client asks a question that I have a really good answer for. Right, because you just want to jump in and like tell them everything about like how the brain works or energy metabolism. And guess what? We don't want our clients to leave feeling overwhelmed. We gotta keep it simple, be able to share what they need to know to get to the next stage of readiness or the next change of action. Someone else wrote, when someone starts sharing deep feelings or thoughts, so then that likely means that they feel safety with you. And they're sharing because either they feel it might be relevant. And I would always bring it back to how that might be impacting their eating choices or behaviors. Because if it's outside of our scope, if it's going into like really deep emotions and therapy, that might be that might be something we might want to tell them with compassion. But it sounds like that might be a topic for someone that's better equipped with the skills to talk about emotional distress, but for the work you're doing with them and how does that relate to their eating and so on and so forth. To help patients taking ownership, coming up with their ideas to manage, achieve their goals. Yeah, so using a lot of the you language can also help. So when we look at the task of MI, the first task is engaging, and it's basically can we walk together? The second one is focusing, it's where are we going? The third one is evoking, why would you go there? So then we shift from the we to the you, and the last one is planning, how do you want to get there? So then using that you language is going to help them, but also emphasizing autonomy so they can take ownership. Okay, so I have some questions or comments. Main takeaways. How to manage change talk and obstacles. This was very helpful. And I realized I need to do more with reflections. Oh, reflections. It's one of those things that we grow into and we practice, and they might sound maybe not natural at the beginning, then we continue to practice them. So it's really neat to see that they start to come more naturally with practice, and also knowing that we're reflecting what we want to be reflecting. Someone else asked, how often do you offer the Coach with Confidence course? So I've been offering it once a year. If there is enough need or enough, I guess, demand for it, I would open up another cohort. But I want to make sure we get enough to run this cohort with 20 people. And then we shall see. But for now, I have it once a year. Okay, so that's all that I have for you today. Thank you for sticking around. This was 15 minutes longer than I anticipated. I will be sending out the link to the replay. If you are in the Empowering Change membership, you will see this replay in your course library. If you are not in the Empowering Change membership, you will have access to the replay on the link I'll send you for the next 4 days or so. If you want to be in the Empowering Change membership, just send me a message. I'd be happy to get you in there. And we have like a special 12-day celebration that you can get in there for 24 bucks a month. And that includes a lot of CEUs on behavior change psychology, MI, and like special discounts for all the other programs. So thank you so, so much for sticking around. If you don't have any more questions, then that will be it. I'm going to stop recording and I'm going to share the replay tonight. It's been an honor being able to share this with you, and I hope you found it valuable. Bye, everyone.